Namaskar, hello and welcome to Sansad TV. I'm Teena Jha. You're watching Perspective. India is once again witnessing a major jump in the number of daily COVID cases. In fact, as we speak, in just the past 24 hours, there's been a massive spike in cases. More than 9,000 cases have been reported countrywide, and the number of Omicron, if we talk about, there have been about 781 cases reported so far. So there's been around a 44% increase from Tuesday, with 9,195 cases reported from across the country. The number of Omicron cases, as I've spoken about, has neared 800, with national capital Delhi topping the chart with 238 cases, followed by Maharashtra with nearly 170 cases as on Wednesday. The variant of concern, Omicron, has now spread to more than 20 states and union territories, prompting the centre to issue an advisory asking states to not let the guard down and take necessary precautions in dealing with the pandemic situation. At least a dozen states have now imposed restrictions and curfews to prevent the surge in infections. With the positivity rate showing an upward trend, Delhi has issued a yellow alert under which all educational institutions, cinema halls and gyms will remain closed. Wedding and funeral gatherings will be capped at 20, and metro trains, buses and restaurants will operate at 50% seating capacity. Also, night curfews and curbs in certain activities have been imposed in other states. Besides, in addition to these precautionary measures, the government is set to begin vaccination against COVID-19 for children between 15 to 18 years of age from the 3rd of January, and a precaution dose for healthcare and frontline workers, and also citizens aged 60 and above from the 10th of January. In Perspective today, we will discuss with experts ways to deal with what looks like an imminent third wave and the need to ramp up our preparedness. Joining me are three distinguished panelists on the program, so let me first introduce them to you. I have with me Dr. RAMAN GANGAKHEDKAR. He's member National Task Force for COVID-19, and Dr. C.G. Pandit, National Chair of the ICMR. Dr. SUNEELA GARG, she's Director, Professor and Head Community Medicine, Maulana Azad Medical College, and Professor Shailendra SAXENA, Head Center for Advanced Research, King George's Medical University, Lucknow. Thank you to all my guests for joining me on the program on Sansad TV. Dr. GANGAKHEDKAR, let me begin the program with you. What we have been witnessing the world over, there's been an 11% increase in COVID cases worldwide in just the past week. And in India, if we look at around 44% increase in COVID cases in just the last 24 hours. How concerning is this situation now?
No, this is definitely a concerning situation because it tells you two things. One, perhaps Omicron, which is a rapidly spreading variant, is trying its best to replicate at such a fast pace that the number of new infections are occurring at a far more rapid pace than anything else. The second thing which we also need to remember, that it is also telling us that perhaps people are not adhering to COVID appropriate behavior, and the entire guidelines, whether they are related to festivities or holidaying or meeting other people, the guard is getting lowered, and that's the reason why you find that Omicron is able to find subjects for infection, and that's not something which is a good sign. Though at the same time, one of the positive things is we also know that Omicron perhaps is not leading to increase in hospitalization and also not leading to as much increase in number of deaths that might occur because of severe COVID disease. But there is one fear that all of us must have in our mind. If you look at UK has almost 90% of the population which is covered with 2 dosages of vaccine. And look at the numbers that they are generating as of now. If you convert them into per million population base, it's so huge.
Yes.
And here we have close to about 37% of the population, which has received only 2 doses, which have not received 2 dosages. You could imagine that the numbers are so high for India, which would be vulnerable. It is still possible that they could pose a major challenge to health sector. At least, one thing is likely to happen, that diagnostic services are going to be stretched maximally because the numbers that may come for testing would be huge.
Absolutely. Dr. Garg, what is your opinion, considering the fact that a month ago, Omicron had just been, detected and not much was known about it. Now it's being reported that its transmission rate is at least 3 times more than that of Delta. And in several countries, it has replaced Delta as the most dominant variant of concern, the most dominant variant which is prevalent today. Dr. Gangakhedkar cited the example of the UK and the United States as well, where once again we are seeing not just a surge in cases, but once again overwhelming public health systems. Now, to prevent such a scenario in India, to prevent what happened during the second outbreak back in April, what are the measures that we should be taking? Obviously, ramping up vaccination is something else. But apart from that, what are the other urgent steps that need to be taken?
Thank you so much, Teena, for asking me this question. First of all, I'd like to tell you that out of 781 cases, we have had recovery of 241 cases also. So, and also if we take the example of Africa, where today only, the paper which has been published, and though it's of small number, that the neutralizing antibodies have gone up by 4 times. So, the cases are recovering also very fast. But nonetheless, you see, it's a time to be cautious and vigilant and not to be careless. That is important part. But coming to our preparedness, we all know that what we faced in our second time, or during second wave was, preparedness of our systems. That means increasing our beds, our bed capacity is substantially quite very high, including the oxygen beds and ventilators, along with the training of manpower, where during this period, the focus also has been training of manpower with regard to, not only adults, but with regard to training, with regard to management of children as well. That is another important part. Apart from that, we need to, I think, address the issue of vaccine hesitancy, which has been, there, and we saw it in, healthcare workers to begin with, and also in substantial proportion of our population. Now, when we are going to vaccinate children from 3rd of January, it's going to be also an important challenge, though it has been long-standing demand of parents as well, with regard to, opening of schools and colleges also. So I think that is where we need to address the issue of vaccine hesitancy also. We have been doing quite well with regard to, the vaccination front, 143 crore. But we also should remember that, 70% of our immunity has come from, the natural infection. So it's a hybrid immunity, what we have got. So that's where, the need of the hour is that we need to be very cautious. We need to be taking action, taking all the, precautions with regard to COVID appropriate behavior. And people who have not taken 2 doses of vaccine, they should go ahead, because you see, though the announcement has been made for, the precaution dose, but that is for those people who have already taken 2 doses of vaccine. And that also, 9 months before.
Certainly.
With regard to healthcare workers, frontline workers, and also elderly population. So,
okay, Dr. Garg, so going forth, how are we going to, prepare ourselves or, go ahead with the vaccination coverage as far as the teenagers are concerned, the 15 to 18 age group, and also the precautionary dose? That is something that I'll come back to you and discuss on the course of the program. But Professor Saxena, what do you think about the Omicron variant of concern? The WHO says it is a risk of concern. Looking at how things are on ground today, the rapid pace at which Omicron has spread far and wide. Today, it's present in at least 120 countries. And in fact, the Indian SARS-CoV-2 Genomics Consortia, the INSACOG, says in its latest bulletin that there is now experimental and clinical data supporting very high immune escape potential of Omicron. How worrying is it? Is it the biggest advantage of Omicron? Is it the major component of its growth advantage over what we have earlier witnessed with the Delta variant of concern?
There's a lot of school of thoughts are going on, and the people worldwide are speculating whatever the way they can. But if you go on to the PubMed, the first original research paper is published by India, and that is by our group. And that was done in collaboration with the South African group, where we have actually characterized it. The couple of mutations which we have shown in that paper were even shown wrong even in the ECDC report, and based on our work, even the ECDC has given a correction and the revision has been posted now. So that's the strength of India. So first of all, the very big thing to understand that in India, we are not just doing it a simple debate here on a television, but also doing a lot of work in the backyard.
Absolutely.
A couple of mutations which we have shown at that specific paper, which is now available in the PubMed also, is showing high transmissibility. And if I compare, as a lot of people are comparing with South Africa and UK, we also have to understand that South Africa has been immunized with a vaccine which is not Covishield or Covaxin. So they are using Johnson and Johnson. So the South Africa model may not be exactly suitable for us as the UK model, because in UK the Covishield has been used very widely. Number one. Number second thing is that the population in UK is also a lot from the Asian origin. So we also have to see that how a particular virus is actually helping in the attachment, or what we say in our language is called glycosylation. So what we have shown that a couple of mutations which we have shown at 417 and several others, the 3 primary mutations in the receptor binding domain, they're actually helping in the better binding. But the good thing is there's a very sharp peak if you see in the UK, but a very sharp fall also. So that's a very encouraging sign that yes, there will be a peak, and several mathematical models coming from various institutes in India is showing that it might come in the month of February, first week or second week, the peak might come, but there will be a very sharp decline within 4 weeks or something like that. Another very important thing which we have to notice is there is a sharp rise in the cases, with the mild and moderate cases, but the severe cases are very low, even in the people who have been vaccinated with both the vaccines earlier. So that's why there's a need to give a booster dose. However, the raw data required behind this, because these are all the EU authorization, emergency authorizations at the moment, how the raw data is actually going to support that which particular vaccine should be given as a booster in these patients, as well as in the mild and moderate cases, how we can handle. Of course, as Dr. Raman said very clearly, that the COVID-appropriate behavior might be one of the very important way to curtail the infection at a very early stage. And as the Delhi government has imposed a lot of regulations for the public gatherings and so on, that can be a very important way by which the infection can be seen at very early stage.
Absolutely. Omicron, Delta, or any other variant, COVID-appropriate behavior is the key to fighting the pandemic. We are still amidst the pandemic. But Dr. Gangakhedkar, coming to you on knowing more about the precautionary dose, which is going to be now administered to the frontline workers, the healthcare workers, and also senior citizens above the age of 60. Help us understand whether these vaccines will be from the available basket. What is the kind of strategy going forward that has been decided? Will there be mixing of vaccines allowed now that we have a bigger basket with several newer vaccines also being incorporated? Or will the same vaccines be used as a precautionary dose as well?
There is one thing which we have to remember. As of now, we have only 2 vaccines which are available. As of now, if you think in terms of the majority of the population that has received 2 dosages, they have received 90% of the dosages are coming from Covishield.
Yes.
So if we were to even go for mixing, the biggest threat was, will we have adequate dosages from Covaxin if we were to have, even if there was no data to support that kind of mixing. We were basing, let's say, assume that we thought theoretically this could be a better approach. But that's not feasible. The emergency use authorization for other 2 vaccines, Corbevax and Covovax, has come recently. Now, so far, once you get emergency use authorization, that doesn't mean it becomes available in the market the next day. There has to be certain procedures which the government will have to follow to procure these vaccines. Therefore, as of now, the 3rd dose is from the same vaccine which the individual has received earlier.
Okay.
However, we are sure that over a period of time, once the availability of dosages is there, and the evidence would also perhaps indicate more and more that if you mix them, perhaps that would be a better strategy. We will definitely go towards it, because both the vaccines are protein subunit vaccines. So they are spike protein subunits, and therefore, if we use them, perhaps it will be something akin to mixing. We should wait for that. because that difference may not be so significant that we need to disbelieve the same dose vaccines that could be offered to an individual. I think what is most important today is to protect oneself with what is available rather than looking at what could be theoretically ideal.
Okay, absolutely. Dr. Garg, a related question and a common question which is being asked by the people at the moment is, why the age group 15 to 18? Why not open it for the entire teenage group, 13 to 18, make them more susceptible, more immune, so that even if they go to schools, the parents are assured that my child is vaccinated. So help us and our viewers understand the rationale behind the 15 to 18 age group being allowed for vaccinations going forth. And secondly, why will they only be administered Covaxin? Dr. Gangakhedkar already said that Covaxin availability is very limited in our country. 90% of the coverage is largely Covishield. So going forward, there could be a shortage of Covaxin doses for children as well.
I think this is a very important question. As you must have realized that, the giving of vaccine is also related to the risk of the individual also. As we started with the healthcare workers, frontline workers, and then we went ahead to 60 years and, above people, and then we came down actually to 45 to 60 and then down to 18 years of age group. Now, when we are going down in a step-by-step fashion, we have to realize that, more, higher the age group is, the more is the risk of infection. And as you would see that, though, the trial has been done for Covaxin also from 2 to 18 years of age, but 15 to 18 years is also a higher age group amongst that group. So we are starting with that age group, and we are seeing increasing obesity also in context of children. And also you see, if you will see the risk of comorbidities, that's going to be little higher in this age group also. So it's better to go in a step-by-step fashion. And we also have to, as you said about the availability, we are going to look at right now 10 crore children in a step-by-step fashion. That means everybody is not going to be immunized on the same day. And we have to, also kind of find the innovative ways to introduce vaccine to or give vaccine to the children. Because, like if we look at Delhi, now the schools are closed. And we don't know that, when we are looking at the graph, that means graded response to, a COVID-19 infection. So we have to have a mix and method kind of a strategy. Somewhere we are going to use schools, somewhere we are going to use, the existing platforms where, because we are going to give Covaxin. So we are going to make exclusive Covaxin platforms and make use of them also where they're already existing. So we are going to make sure of that part. But again, I said that addressing vaccine hesitancy amongst parents also for their children is going to be an issue of concern. But then we are going in a step-by-step fashion and then again, once this age group is covered, then one will think of going down to the lower level. That will be another important thing.
Okay. Professor Saxena, as on date, the biggest concern obviously emanates from Omicron and the manner in which it is spreading globally. In India, we have seen how in a matter of 10 days, the cases have gone on an upsurge. Given the high transmissibility of Omicron, do we need to also change the quarantine and isolation rules? So, okay, it's not as severe as the Delta, but the transmission rate is quite high, and that is something that is a fact today. That there is scientific evidence to prove that. The UK, the US, and South Africa, the three countries which have been largely impacted, have tweaked their isolation and quarantine rules, particularly for the asymptomatic patients. Do we also need to do something of a similar kind if we are looking at a surge or a Omicron-led third wave in February, as is being predicted?
Of course, yes. And Government of India is already doing a lot of these things. The countries from where the initial cases have been reported, all the flights, the people who are coming, they have been gone for the rapid antigen test at the airport itself. There's a lot of contact tracing and other things have been done. There's a lot of history has been taken for the people who have visited the different countries and so on. We have also seen the cases where the people have got infection during the transit or changing the planes in the different countries, and even they were actually originally infected with, let's say, Delta, and now they are having Omicron also. So a couple of these kind of cases are coming. So of course, we need to keep on changing these policies time to time as and when the things are required. there might be a need that for some time period we also have to close the international travel, and it was thought earlier, but still it is in the pipeline that if it is required, it can be done at the later stage.
Dr. Gangakhedkar, in order to do that, what's important is that the assessment of the variant is done rightly. So after 2 years of the pandemic, now we are now staring at an imminent third wave led by Omicron. What are the kind of facilities that are available in India right now to assess the correct variant?
I would be little circumspect in giving my opinion on this, because in India, we do not know. See, Omicron is not only one type of variant. Today, you have BA1, which is also from the same lineage, which has Delta 69/70 deletion. And that particular deletion was one which was responsible for ensuring that spike gene is not lighted up in the tests that were used. But of late, Omicron is also producing a different variant which is part of the same lineage, which is called as BA2. Now in BA2, you don't have that worry because you don't have this 69/70 deletion, and therefore every RT-PCR test tends to pick it up. Now, this is one part of the story. Now, it essentially means that if let's assume that the whole variants will get replaced by BA2 kind of a variant, then in those cases, your RT-PCR kits will continue to remain valid in picking up these patients who may be either Omicron or they may be due to Delta. Now, the issue that comes up is, would I require genomic sequencing? To my mind, genomic sequencing may not be required as much because we will learn very quickly on how quickly is this variant trying to replace the Delta variant. We already had a severe Delta wave in the past, so the variant that may come very shortly would essentially is more likely to be this Omicron variant. So you may not need genomic sequencing as often as we are doing right now to diagnose Omicron over a period of time. But all these can be speculations because we have to still wait and see how does it pan out, this Omicron infection, how does it pan out? Does it replace Delta as it is replacing in UK, as it is also replacing even in USA and also to some extent in South Africa. So essentially, we will have to wait. But I think we with our wherewithal, the huge lab infrastructure that we have, the number of institutions that can cope up, even genomic sequencing being fairly high enough, we should be in a better position to take steps to diagnose. The second issue which I will also allude to is within a short period of time, one will have to develop different clinical definitions to diagnose Omicron because it has distinct set of symptoms and signs that are associated with it. And then RT-PCR positivity could be used as one which would be a composite indicator of Omicron being the variant which is infecting an individual. So less of genomic sequencing is perhaps more likely scenario. So essentially whatever we have should serve the purpose really well over next few weeks as we will understand more and more.
Absolutely. And given the unpredictable nature of the epidemic, the manner in which newer variants are emerging one after the other, threatening future waves of the pandemic as well, the most important element that people must follow is COVID-appropriate behavior. As all three of our panelists have pointed out, vaccinations are happening at an impressive pace in our country. We have witnessed in the past 1 year. Now there are precautionary doses being given to the senior citizens, the healthcare and frontline workers as well. The vaccinations are being opened up for 15 to 18 years of age group as well. But what's important on our part is that we all have to take necessary precautions. Pandemic appropriate behavior is something that we have to stick to at least for a few more months. So with that, I'll have to call it a wrap on this edition of Perspective. Thank you to all my guests once again for joining us on the program and sharing your thoughts with us and our viewers. So that's it from us on this edition of Perspective today. Thanks very much to our viewers for their time as well. Take care, maintain COVID-appropriate behavior, maintain social distancing, and take care of your families as well. Thank you. Thank you and goodbye.